I'm Dr. Madhuvanthi Hettiarachchi, consultant physician in internal medicine. With Sri Lanka College of Internal Medicine, today I'm going to talk to you about high blood pressure. High blood pressure is also called a silent killer. You don't have any symptoms most of the time. That is why it is called silent killer. But if your blood pressure is not under control for a long time, then you can get quite a lot of complications such as heart failure, heart attacks, strokes, even loss of vision. Therefore, it is important for us to know what are the risk factors for high blood pressure and how to control it. It is estimated that around 7.5 million people in the world die due to high blood pressure. In Sri Lanka also, it's about 1 in 3 people. Let us learn what is high blood pressure. Your blood pressure is measured in millimeters of mercury. Blood pressure value usually comes in 2 figures. The first figure is your systolic blood pressure and the second figure is the diastolic blood pressure. When your blood pressure is more than 140 over 90 millimeters of mercury repeatedly, we call it high blood pressure. But remember, with just one blood pressure reading, we will not call as you are having high blood pressure. So you have to have at least few readings of blood pressure to call it high blood pressure. Let us see when we should get our blood pressure checked. It is an important part of the general health screening. Your doctor will advise you when to do your blood pressure checking. Usually in Sri Lanka, if you are about 35 years or older, depending on your health problems, your doctor will advise you to check the blood pressure annually. But if you have other complications, you might have to get the blood pressure checked even at an earlier stage. Now I would like to talk about the symptoms of high blood pressure. Most of the time, most people do not have any symptoms of high blood pressure. But sometimes they can present with fatigue, buzzing of the ears, headache, nausea, vomiting, nasal bleeding. But sometimes they might not occur even when the blood pressure is very high. Therefore, we call it a silent killer. Therefore, please remember to get your blood pressure checked annually if you are 35 years or older.